China, where COVID-19 emerged in late December last year, shortlisted 30 drugs they say fight the virus, as scientists are in a race to find a treatment for the coronavirus, which has killed over 16,000 people worldwide in the last 3 months. One of the medicines picked by the Chinese National Health Commission is interferon alpha-2b, which has been produced in China by a Cuban-Chinese joint venture since 2003. The drug has reportedly been effective in the treatment of HIV, human papillomavirus, hepatitis B and C, and has reportedly been effective with viruses with characteristics similar to those of COVID-19. Grenada's acting chief medical officer, Dr. Francis Martin, says they intend to further verify the reports to determine if it could be used to treat the virus locally.
Cuba is producing something called interferon 2b that they claim was used in China. We do have a video conference that is set up between some Chinese doctors and ourselves. We haven't had it yet. We just tested the procedure. This is one of the questions I will be asking them. Did you use interferon 2b? And if you did, how well did it work? Because as we know now, there are trials going on different drugs, but there's not been a conclusive evidence that any one works better than the other.
In the meantime, people are advised against self-medicating, including the use of Tylenol, ibuprofen and other anti-inflammatory drugs, following conflicting reports about how effective it is in treating the virus. Dr. Martin reiterates that not all information circulating is based on extensive research.
We saw that. We have done our due diligence. We've checked with the World Health Organization. This may have been a case study that was done, and sometimes when case studies are done, people blow those case studies out of control. So that is the thing, our citizens need to read a little deeper to understand and not just jump to conclusion when they see something that sounds scandalous.
Health officials across the world are issuing warnings over the use of anti-malarial drugs after U.S. President Donald Trump's comments about treating the coronavirus with them sparked panic buying and overdoses in Nigeria and the death of a man in the United States. Blossom Alexis Welsh, GBN News.